Welcome to Hope and Resilience Podcast. I'm John Hitchens, and today I have a good friend of mine back on, Dr. Larry James. Good morning, Dr. James. It's a pleasure to meet with you again.
Good morning, old friend. It's always good to see you and get a chance to visit with you again. So aloha, from
Aloha. Yeah, I got sweaters on and I'm freezing over here, but yeah, aloha. That's awesome. Well, I want to thank you because every time you come on, you share some great information with us. And today I've been excited about this topic ever since you said you'd like to do it. Basically, today you're going to share some information on post-traumatic stress disorder, PTSD. And so I'd love to get right into it if you're ready for the first question.
Absolutely. Yeah, absolutely.
All right. So everybody wants to know what exactly is post-traumatic stress disorder and how is it defined?
Okay. Yeah. John, those are some great, really, the $1 million questions. You and I go back a ways in the military, and a little bit before your time as well as mine. It was called a different thing back in, the Vietnam era. And so in the 60s and then there towards the end of the war, the mid 70s, we had all of these airmen and women and soldiers and sailors and Marines coming back from traumatic battle situations with what we called back then shell shock. And, talk about, changing who these great, war heroes were before the war. They came back so different. Well, years have gone by, billions of dollars of research into this disease that we call post-traumatic stress disorder. That's what the new modern day term, the international term or diagnosis for that disorder. So post-traumatic stress disorder is a recognized medical and psychiatric disease with someone who has been exposed to a pretty significant traumatic event. And let me just give the viewers some ideas of what do I mean by a significant traumatic event. You don't have to be, a soldier or a Marine or, a policeman or a fireman to get PTSD. It's not only limited to that, to that situation. Very common in those occupations, but certainly, the average American walking down the street can suffer from that disorder. But some of the triggers or some of the traumatic events that we commonly see, or things like a horrific death. For example, let's say hypothetically, my neighbor is going to the grocery store tonight with his family. Gets rear-ended. The gas tank explodes because the car is rear-ended. The doors are jammed. They can't get out of the car. And the husband is driving and he can crack the window, crawl out, but yet he has to watch. He can't get his wife and two kids, the two kids in the back seat out in time. And he's standing there listening to their, horrific screams and watching these people that he loved burn to death. That's very, very traumatic. These school shootings or, oh my gosh, it's like every other day we turn on the news or read the newspaper or go online to catch up on, news. We see these things about, someone, mentally unstable goes into an elementary school or high school, or the most recent one, John, happened to be a Walmart, where a supervisor, imagine being an employee there, going into what you would think is a very, very safe place, the break room, to have a cup of coffee or eat a sandwich on your lunch hour or what have you. And a supervisor, comes in with a semi-automatic weapon and kills a bunch of people right there in front of you. And of course you feel, not only you're terrified, but you feel helpless. There's nothing you can do. Yeah. Another example, is sexual assaults. Now in the, I mentioned, your military service a minute ago as well as mine. Whenever we do evaluations on veterans who are referred from the VA, we must address something that's called MST, which stands for military sexual trauma. and that applies to both female vets, and nowadays as well male veterans. It's surprising how many male veterans that I see who have PTSD because he was sexually assaulted while serving this great nation.
Yeah.
So those are just a few examples that kind of the common things that we see that are triggers for someone to start having symptoms of post-traumatic stress disorder.
Those are just amazing stories, just even hypothetical, but like you said, a lot of it's probably not hypothetical, definitely happening. So my next question is, how does one get PTSD? Okay, you talked about the events. How does it happen from these events? How does it affect the person? How does
it develop, and what are some of the symptoms?
Yeah.
Okay, and that's some of the $1 million questions. So I've given some of the examples of some of the common traumatic types of things that can happen to an adult or a child. We can't leave out the kids in this. Again, back to those school shootings that are all too common nowadays. We can't. I don't want the viewers to think that because someone is 10 years of age or 14 or what have you, that person cannot be diagnosed with post-traumatic stress disorder. But before I go any further, John, I want to mention one of the kind of the new things that we're seeing, how people are suffering from some of these traumatic events, death and dying. So let me say a little bit more about that. Let's say, my next door neighbor is the caretaker for his elderly mother or father who has terminal cancer, and it's been a 3-year process, and they call this neighbor Bill, and Bill has he's moved his father, because his mother passed away years ago. He's moved his father into his home, and he has watched his father slowly but surely rot away. His father, is big strapping fellow, 6'4", 230, 240 pounds. And now his father's down to 70 pounds. And he was there when his father actually took his last gasping breath before he died. And so we're seeing patients like that now that have a different experience, a different type of life trauma. And they're having, in terms of symptoms of PTSD, they're suffering from some of the classic symptoms, the horrifying nightmares, where this person will be woken up from a sound sleep, where he will have a nightmare where he is there, seeing and hearing his father take his last breath. And these dreams or these nightmares, John, are so horrifying. It puts that person as though they are back in that situation, where they are reliving that situation night after night after night after night. And really, in bad cases, these people, the nightmares are so severe that these individuals are really only sleeping 2 or 3 hours a night. And then what happens is that's where the alcohol and the drugs come in, because they want to drug themselves up or numb themselves up into such an extreme cases where they can just sleep through the nightmare. So the PTSD can lead to some of these other types of problems. But let me go on and talk about some of the other signs and symptoms. So I've already mentioned common nightmares is one. And speaking as a veteran, a second one that we see that's very common among combat veterans is avoidance. The common one that a lot of veterans will tell me, the July 4th fireworks, or the New Year's Eve fireworks. I mean, that will, some of these vets, they will start hearing those popping sounds, and they will start having the third symptoms, which is like flashbacks, which will put them back into that, as though they're reliving that combat situation. Okay. Number 4, these veterans and people walking down the street, they will start to avoid situations that they would easily visit before they experience the trauma. And so again, You have this policewoman was involved in a shooting incident where either they were shot or they, killed someone in the line of duty defending their life or the life of someone else. Before this shooting incident where they killed someone or they were shot, man, they would go to the July 4th picnic and be there with take the kids to the fireworks and all that. Or, New Year's Eve, they would have a box of firecrackers and things like that. Now, at 11:30, p.m. on New Year's Eve night, this policewoman is literally hiding under the kitchen table because those sounds will create that traumatic experience. Will recreate that traumatic experience.
So that's amazing. It can happen like that.
Yeah, yeah, it will bring it back just like they're in that situation. And so now what causes a rub or a problem, interpersonally with all the other people in their house, and let's say that policewoman is married. Again, before the shooting incident, she used to love to go to the July 4th picnics or the New Year's Eve celebration. Now her husband or partner is giving her a hard time because she wants to avoid, and that's another symptom, avoid situations that before the traumatic event we used to enjoy and be very pleasurable and attend without any trouble, and now on these July 4th and New Year's Eve, they want to literally lock themselves in the house, and just not go out. Let me go on to one of the last ones, but certainly not least, is this what we call hypervigilance. People with PTSD become so doggone hypervigilant. It's when they go to bed at night, John, they are constantly getting up and down, up and down, up and down all throughout the night, because the simplest little sound, a creak in the floors, and if they live in an old house with wooden floors or something like that, a neighbor who walks their dog every night at, let's say midnight, and they can hear, their neighbors just innocently walking the dog and talking on his or her cell phone. And that can startle someone with PTSD. Well, what do? They literally get up and they go and they check every door that goes outside to make sure it's locked. They check every window in the house to make sure it's locked. If they have a 360-degree video security system of their property, they go check to make sure nobody's, no strangers are in their backyard or anything like that. And they tend to possess. Well, not all. I don't want to make it sound like all people with PTSD possess a lot of weapons, but I see that very, very commonly among the veterans and the law enforcement people. It's a real problem at many of the veterans hospitals and clinics around the country because many of these veterans feel so unsafe and they're so hypervigilant about their surroundings. They never ever leave their house without being armed, and I mean very, very well armed, John.
Yeah, well, and they have the knowledge and the capacity to be able to do that, and that's just amazing to live a life like that. I mean, it just sounds very disruptive and horrifying for them. I mean, to have that kind of fear racing through you constantly, it would be difficult. So, let's say I'm one of those individuals. I have that issue. I've had something in my life that has actually, brought on all these different symptoms and signs. Mm-hmm. How do you treat someone with PTSD? Okay. How do they find help?
That's a wonderful, boy, again, that's another $1 million question. But I want to, if I can, I want to just mention one other symptom that's called intrusive thoughts. And so let's say, again, I've been exposed to some traumatic event. And by the way, these symptoms have to last for at least 30 days for someone to be classified as, having post-traumatic stress disorder. The psychologically healthy adult, male or female, when we experience these life events, we might have a little trouble sleeping, getting back to normal, but certainly by about 30 days, most of us will get back to the normal routine. And so after about 30 days, if these symptoms are still incredibly bothersome, where they're interfering with, with me going to school, interfering with my marital or social relationships,
Yeah.
interfering with me performing my job duties, and it's been going on for more than 30 days, then I need to seek professional help. Okay. And so as part of this, the last symptom I want to mention is that what we call intrusive thoughts. And what happens with intrusive thoughts, let me give you an example. My I, in fact, I saw a veteran yesterday, who was in Iraq, and when he was in Iraq, he was using a porta potty. And John, as you know, porta potties, the cleaning service uses a unique type of liquid chemical to clean these porta potties, and it's got a very, very unique smell. Anyway, this retired military guy, when he was going to the porta potty in Iraq, his unit, his compound was attacked, and a mortar shell came in and ripped this porta potty to pieces. And so, anytime he is walking down the street, let's say it's a construction site or what have you, and there's two or three porta potties, he literally crosses the street, because that unique smell that all porta potties have from that cleaning chemical,
Yeah.
or in his case, just the sight of a porta potty, he'll start having flashbacks or really bad memories, about when and this guy, I believe it was his right leg that was shattered, had to be amputated. So
Yeah.
intrusive thoughts is a classic symptom. All right, so let's go on to the question you asked me, John. Let's talk about
Yeah. All right.
let's talk about treatment. Now, before COVID, if you wanted to do any, behavioral health treatment, counseling, or what have you, you had to do it the old-fashioned way. You had to go into the clinic, and now we know one of the silver linings, one of the positive things that came, that came out of COVID, is a lot of the virtual, a lot of insurance companies now are paying for patients to go to see their psychologists, psychiatrists, counselors, therapists virtually.
Yeah. The
Uh,
telehealth is just
yes,
exploded.
that's
Yeah.
telehealth is exploding, and so that's particularly important for patients who are struggling with PTSD, because again, avoidance, as I mentioned earlier, avoidance and social isolation is one of the symptoms. So some of the viewers may be thinking, "Oh my gosh, all the things that Dr. James mentioned, all those symptoms of PTSD, I've got every one of them. But boy, there is no way I'm going to,
Yeah.
to the clinic or the hospital. There's just no way." Fear not. Telehealth is paid for by most of the large insurance companies out there. All right, so I think that's an important point for me to highlight, because of the symptom of avoidance.
Oh yeah.
So let's talk.
I mean,
So let's talk about treatment.
okay.
So the VA has really led the way, nationally, and internationally, in terms of pioneering what we call evidence-based treatment. That means something that has been researched and researched. There are many well done scientific studies to validate specific types of treatments, be it medical or psychiatric treatments, to treat PTSD as well as other conditions. And these treatments that I'm going to mention, or these therapy modalities, are available to the general public. One is called prolonged exposure, therapy. And John, that is so. Let's say again, you were in a horrific traffic accident where you almost died. Leg had to be, the fireman had to use the jaws of life to literally cut you out of the vehicle, and unfortunately, your left leg had to be amputated. In prolonged exposure with someone who is trained in that intervention modality, there's a way this person can, psychologically re-expose you and re-expose you and re-expose you to that traumatic event, to a point where it actually begins to desensitize you to thoughts, smells, memories, recollections, anything associated, to that traumatic event. And it works, very, very well. The second scientifically validated treatment that we have, is called cognitive processing. And so and that technique really helps that person with this disease, rethink or reconceptualize the way they see these traumatic memories and things like that. There are tons of psychologists and psychiatrists and therapists in the Dayton metropolitan area that are well trained in these two types of treatment. And the third one that I frankly enjoy using the most it's really a humanistic or existential approach. In my private practice, I see mostly veterans in law enforcement, and the humanistic approach is helping that that veteran or that policeman redefine or come up with a new understanding of what it means to be a man or a woman, given the physical challenges that they now have, as a result of having an arm amputated or a leg amputated, or still having shrapnel in their brain or something, or something like that. So those are the three treatment modalities, and I guess the fourth would be medication interventions. There are some daggone good medications out there that are safe, that someone's primary care physician or psychiatrist can prescribe, that will block the nightmares, so that these, and then there's some pretty good sleep medications, and these medications, John, are non-addictive, not and so I mean, John, just imagine, for the let's do a study with you, and you're going to come to my clinic, and I run a sleep clinic, and the goal is I'm only going to let you sleep at max 2 hours a night for the next month. Imagine and let's say you have no traumatic event, no PTSD, nothing like that, and the goal is to only allow you to sleep 2 hours a night. So we one of the things we learned from the Vietnam War is that these men and women back then who were shell shocked, rather than putting them on a plane and air vacuuming them home, we would bring them back to the mobile hospital, give them something, hot meal, hot shower, and by golly, let them sleep. And what we found is that after about 72 hours, the vast majority of these great men and women could go back to the battlefront. Okay, and so helping these people with these horrible nightmares night after night after night, to be able to get some sleep goes a long ways in helping them getting back on the path to recovery from PTSD. So
yeah, I mean, if I only got 2 hours of sleep for a month and had nothing other than that issue, I'd be a mess by the time.
Yeah,
let alone everything else you deal with.
Yeah, I mean that's the and imagine you've got a 7-year-old, a 10-year-old, and a 12-year-old, and you work full time, and your wife works full time. You got a house and all these types of things to juggle simultaneously, and you're only sleeping 2-3 hours a night. So for the treating psychologists or therapists or psychiatrists, helping these patients be able to sleep. Oh my gosh, it's I can't describe how important that is.
How that's therapeutic it would be to get a real good night's rest. That's amazing.
Yeah, you bet. All right.
Well,
other questions, my friend, or comments?
No, I just want to thank you for all that we've covered. Like I said, I was really looking forward to this one, and you've done a great job of helping us understand it. The 30-day thing, I think, is critical because, there's times at night I get up too and worry about stuff, but it's not a lengthy time like that. And so getting those cutoffs of where you may need to come and get help
Mhm.
talking about the telehealth. That's critical. If we have an issue and I don't want to go anywhere to fix it, then I can't get help. But now
That's right.
it's tremendous thing that they have telehealth. And like you said, most insurance companies will pay for that. This has all been great information for people that may be struggling with it or having someone that does. So I just really thank you again for coming on. It's been amazing.
Yeah, my pleasure. Um, all right, thank you, so much, my friend. Good to seeing you, and again, I'm available. So if I can help in any way, you know how to get a hold of me.